So let us know a little bit about someone who comes to you, woman, brain fog, maybe sort of perimenopausal. Take us through the journey, Dr. Kavita.
Yeah, so perimenopause, which is all the years leading up to essentially when our period stops, right? It's technically a natural process. We know that it happens. The first hormone to start dropping in both men and women is testosterone. So now we're talking we lose muscle mass and bone health is at risk. Then it's progesterone, which messes with our sleep and mood, and then estrogen, right? And so again, now our mood starts to be affected significantly. Stress goes up, anxiety goes up, and a lot of women feel foggy. And I think it's partially probably due to poor sleep, but also just without these hormones, we just don't function as well. So in terms of addressing that, it's almost identical to the way we address cognitive decline in general, that we have to look at the big picture. There's not one quick fix. I do like to recommend bioidentical hormone replacement for women that are, that qualify for it if they have no other risk factors, because replacing them can often really help improve a lot of those symptoms, and the brain fog is one of them. And then it's got to be a lot of lifestyle choices. Perimenopausal women don't process carbohydrates the same anymore. So even what a lot of women find is that suddenly the things they were doing, 5, 6 years ago don't work anymore. And the diet has to be very, very strict, and much, much healthier. Again, from a mental health standpoint, staying active, being social, surrounding yourselves with the right people and the right foods becomes critical, because our gut microbiome is thrown off by the loss of these hormones. So all the risk factors that we try to prevent are just amplified with the loss of estrogen and progesterone. So for women, and then I think in my mom's case, for instance, she did not present with memory loss initially. It was a personality change, which now looking back, she was in her 50s roughly at the time when her symptoms first started. And was it menopausal, or was it the beginning of her Alzheimer's? I don't, it's hard to tell because they seem exactly the same. So I think for women, again, if they have a cluster of symptoms, it's more likely to be menopause related, in which case they can get their hormone levels checked. They can try supplementing and seeing if they improve. If it's more serious, where it's not just, forgetting common, like, where did I put my keys? It's more, what are my keys, right? It's more serious memory loss. That's when we should be considering, going to a neurologist and having, a mini mental test done, having an MRI done to check to see if there's any early stages of Alzheimer's or dementia in general that could be in play.
Okay, so someone comes to you, then from your perspective, what are you doing just to help people, and with regards to, women that are perimenopausal, or maybe you want to talk about xenoestrogens and just how many estrogens are in sort of the plastics and that are found in our water, and the increase of estrogen that's causing issues. So, give us a sort of a backstory on that and what you recommend these women do, because obviously they're in this sort of transitional time in their lives, and it's difficult for them.
Yeah, because it's out of our control, right? And I think the first thing that I've been trying to do when I started Revival is educating women, because I think for years we've normalized it, as we do with many disease states, that this is normal, this is what women go through, but we're seeing a link between these side effects and long-term chronic disease, whether it's cognitive decline, heart disease, osteoporosis, we're seeing fibromyalgia. A lot of perimenopausal women seem to be the demographic that has the larger incidence of having these diseases. So I think it's something we need to start addressing to start reversing some of this risk.
And when you say education, sorry, Dr. Kavita, just what we've spoken now, everything we've spoken up, you educate women who come in.
Yes, because I think they can't advocate for themselves if they don't know to be asking for help, or that we don't need to normalize it anymore. Because I think in medicine, we're still not doing a preventative approach to how we address long-term disease risk. It still seems to be a treat after the fact, and by then it's too late. And my mom was a great example of that. And she herself was a physician, my dad's a physician, and we missed it. So, it was very eye-opening when it happens to somebody. And she was non-drinker, non-smoker, didn't have any other major risk factors that would have been, concerning to us that this could happen. So I think we're at risk. We don't know we're at risk, and then we just feel unwell, and then that can turn into other long-term diseases. And yeah, from the xenoestrogens, we're just bombarded with it. So I think this is where the more we take care of ourselves and try to eliminate plastics from our life. For instance, I only use glass water bottles. You store your food in glass. Try not to use pans that have a lot of the nonstick coating on them. As much as we can reduce all the chemicals we're ingesting. Environmentally, it's a little harder to control unless you can, bring filters into your home. Filter water, although, in first world countries, we do consider our water clean. It has a lot of microplastics and pesticides and organophosphates in that water that is going to slowly kill us. So I think we need to be filtering our water, whether it's with reverse osmosis or carbon filters or, whatever you can get for your home. That can certainly help reduce how much damage we're doing to our bodies and to our hormonal system. The natural loss of those hormones is going to happen no matter what, but if we can, prevent amplifying the issue, that's ideal. And I think we can do that also with diet. By the stronger we make our own immune system and our own gut microbiome, we can filter and process a lot better than if we don't try to create our own, healthy environment.